And good afternoon, colleagues. We want to welcome ministers and officials from the Ministry of Health to the special call press conference here at the Office of the Prime Minister as we bring to an end the state of emergency here in the Commonwealth of the Bahamas. What does it mean? I know many of you have been asking questions as to what does it mean, what's in play, what's not in play, and we have ministers who are able to address those. The Attorney General, Senator the Honorable Ryan Pinder, is here to provide support, and of course the Minister of Health and Wellness, the Honorable Michael Darville, who will speak to the issues and give you what information you need to know when the civil liberties, we call it, are restored to you in just a matter of hours. So without further ado, I'm going to invite the Minister of Health and Wellness, Dr. Michael Darville, to come and address us, give us a few points, and then we'll open up for questions and answers to get you up to speed. Thank you, and welcome, Minister.
Thank you so much, Clint, and sorry for being a few minutes late. To my cabinet colleague, the Honorable Ryan Pinder, the Minister responsible for our legal issues and the AG, to my team from the Ministry of Health, and to the media and to the Bahamian people, a good afternoon. Prior to coming to office, the Progressive Liberal Party in its blueprint for change promised the Bahamian people that when elected to government, we would immediately remove the emergency orders, which would have been in place for the last 18 months, and instead manage the COVID pandemic by way of legislation. It was our view then, still our view now, that the prolonged use of the emergency orders not only stifled the possibility for economic growth, but also negatively affected our civil liberties. On November the 1st, as the new Minister of Health and Wellness, I laid in the House of Assembly 2 pieces of legislation to replace the emergency orders, which are scheduled to expire tomorrow. The Health Services COVID-19 Prevention Management of Community Spread Rules 2021, the Health Services COVID-19 General Rules 2021. These rules are amended to the Health Services Act Section 29, and once tabled in the House of Assembly, went for consultation to the business community, the religious teams, sporting communities for review and feedback. I am pleased to advise that based on the feedback from these groups and other sectors of society, we have made changes to those rules, and today we will be gazetting the amended versions of those rules. Effective November the 13th, 2021, the emergency orders will fall away, and going forward, these new rules would form the regulatory framework to manage the COVID pandemic. The new legislation provides clear and specific guidance regarding the prevention and management of community spread of this virus, proving that we are moving in the right direction. It also addresses the management of COVID-19 in our country, essential COVID protocols, as well as health protocols for businesses, social gatherings, and other activities, among other details. Further, and very importantly, it outlines the process regarding enforcement of these rules and the penalties for non-compliance. Ladies and gentlemen, and members of the media, it is important to point out that new legislation gives us the flexibility to make changes to these rules as the parameters of the pandemic changes. These rules provide for an advisory committee made up of experts in epidemiology, supply management, logistics, health service administration, and public health. Should our present condition deteriorate, and as the country we begin to see spikes in new COVID cases, the epidemiological evidence of community spread, we can base our recommendations from the advisory committee, adjust these rules to ensure that we protect the public. Conversely, if the condition improves, the advisory committee will make recommendations for further relaxation of the rules. A significant amount of work has been completed within a tight, short period of time in order for us to get to where we are today. Therefore, I wish to take this opportunity to thank the Attorney General, my medical colleagues, and the staff from his office, including Dame Anita Allen, for their work in drafting these pieces of legislation. I am also grateful to the Chamber of Commerce, the Bahamas Christian Council, and various sporting associations for their feedback, and last but not least, the Bahamian people who will have to abide by these rules. This pandemic has run havoc in our lives and our livelihoods, and I believe with God's help and self-discipline, we can control the pandemic. These rules provide the framework for the fight and for each of us to do our part so that we can win. I am confident that with God's help, hard work, and all of us abiding by the rules, we can reach some degree of normalcy and to get our economy up and going again. Finally, before I close, I remind all Bahamians that it is time to get vaccinated. It has been scientifically proven that vaccination reduces the severity of the impact of the virus in our hospitals, and it saves lives. We have an adequate supply of vaccines, and we are pleading again, please get vaccinated. Thank you. I now open the floor for questions, and of course, the questions can be directed to myself, to the Attorney General, and of course, I have my team. I am not alone, and our team has been working diligently at the Ministry of Health and Wellness in order for us to be where we are today.
Dr. Darville, I'm assuming the mask mandate hasn't changed at all. Could you elaborate on that?
Well, the mask mandate is one of the greatest tools in our public health fight against the virus. We know that the virus has now been classified as airborne, and so when we come into a room or an enclosed area, it's important for us to be able to wear our masks so that we can protect one another. The legislation is clear on where the mask should be worn, how it should be worn, and we, in our plans as it relates to free testing, we also have a plan to give away high-quality medical masks in our fight against COVID-19 for individuals who are requesting masks and those who maybe cannot afford to get masks. So we are having that in our rollout. We're still in our pilot project phase of free testing, but I assure you that part of our plan is to ensure that Bahamians have access to proper masks.
I know that you were, questioned in the House of Assembly about some of the changes, additions, adjustments to collecting data. I think the conversation had to do with the collection of blood and saliva and that sort of thing. Could you elaborate on how you have adjusted or added to the procedures that you're going to use to collect data on what's happening with COVID?
Well, I was a bit confused with the question myself because it is the lab and medical teams who have always collected samples. These samples are moved to the appropriate places for diagnostic testings, and the results are forwarded back to the physician or the nurse in charge or the relevant healthcare professional for analysis of the data. When it comes to testing, we have the rapid antigen test, which is a part of our arsenal. We have the PCR tests. We know exactly, most of us have experienced what is involved in the testing. And they are usually trained individuals who go ahead and do the sample collection. And the sample is moved to the lab where the test is completed and the result is posted in real time. And so there's nothing new with the way how we would do the testing. It's medical protocols that have already been established. And so I was a bit confused with the question. And in our rules, the lab facilities and our hospital facilities and those who are doing the testing know exactly what to do. They're trained to do it.
And one more question for me, if I may. You started the free testing on some of the family islands. Was the availability, or is it too soon to tell if the availability of testing, free testing, resulted in or told you anything about the rate of infection as opposed to when persons were doing it only voluntarily?
Free testing that was utilized in our family islands were done in the early stages of some major clusters of infections that existed in Inagua, some were in Eleuthera, the Berry Islands. And so it was a perfect opportunity for us to gain data and to find the necessary epidemiological evidence to test the integrity of our clusters and make a determination if we are seeing community spread via cluster control by our contact tracing team. And we were very fortunate in all of those cases to confirm that the cluster integrity were intact and there was not any evidence of community spread, which is reflective now because after being in quarantine for 2 weeks and in isolation, the virus itself burns out and the cluster dies. And so if you look at our dashboard, you will begin to see that the new cases in our family islands are absolutely going down. In most areas, there's no cases being reported at this time while testing is ongoing.
Dr. Darville, I know you confirmed 2 weeks ago that there would no longer be a curfew under the new rules. But looking over the rules, a lot of the safety protocols, COVID-19 prevention protocols stayed the same. Mask wearing, social distancing. I know you confirmed that there will be no curfew, but what changed between a few months ago when health officials were saying you want to have people not out socially gathering after a certain point in time, and is there any concern that people will just go and start partying because they can be out all night?
There's always concern. One of the greatest challenges anyone could face and any government could face is trying to regulate a pandemic. We've said it when we were in opposition. I've said it when I was the shadow minister of health, that we will not support the emergency orders simply because it took away much of our civil liberties. Curfew is taking away someone's civil liberty. Lockdowns is taking away someone's civil liberties. And we felt after we supported the emergency orders or the proclamation for emergency that 18 months was too long. And we need to control and manage this pandemic via a legislative route rather than forming an emergency state. 18 months. And you talk about increasing it. It's not acceptable and certainly not viable in order for us to be able to move our economy and begin to get our kids back to school, to be able to get our tourism sector up and going in a safe way, and the list goes on, and getting people back to work. It was not sustainable then, and it is not sustainable now, the proclamation for an emergency order. We have to manage the pandemic via legislative means. It is not a perfect means, but at the end of the day, we have to be able to do it. Other countries are doing it. Why can't we follow suit?
So will the government not reintroduce a curfew at any point in the pandemic?
Well, like I said before, we understand the science and we understand what curfews mean. We're not convinced that curfews is a true reflection of the science and the reduction of community spread. It has a place because when you have a curfew, you actually can limit the movement of an individual at a particular time. What we're saying is that we're expecting Bahamians to be disciplined. We need to move forward. There's a whole sector in our business community that has died as a result of the curfew. We have people who are in that sector who are on our food lines looking for monies to actually survive. We cannot, as a tourism country, begin to stop activities at a particular time and expect a certain sector of the economy to grow. But with that being said, it is important for us to be good stewards of what is in place. Let us follow the rules and allow us an opportunity to see if we can get this industry up and going again in a safe way.
So let's say Bahamians aren't disciplined and we start to see 100+ cases a day and things just get really bad where the hospitals are full and the healthcare workers say they cannot deal with it. Will we not reintroduce a curfew?
Well, as it stands right now, our numbers are going down, and we actually changed the curfew hours. And so I want to speak of what is in place now. As a government, we have the opportunity to use a lot of different techniques and tools if the pandemic gets in a particular position. That's why we have an advisory committee. The advisory committee, with our technical support team, will guide us on whatever we need to do to protect lives, families, and prevent person-to-person spread. As it stands today, we are laying two pieces of rules via the amendment of the Health Services Act in order for us to move from a state of emergency to manage the pandemic with legislative form. I'm confident that we have come this far as a result of instituting quite a bit of new policies and testing it, and we feel confident that as we stand now, with the curfew being rolled back a few hours when we got into office, and we're seeing the numbers go down, it is obvious that Bahamians are executing the necessary public health protocols, and I feel confident that with the grace of God, we will continue in this trajectory, and at the end of the day, we will be able to get a lot back of what we lost as a result of what the pandemic has done to us this far.
Now, Dr. Darville, you noted that your ministry is preparing for a possible fourth wave, and in Bahamian culture, I guess you can say we are not proactive in a sense. Can you go into detail exactly how are we preparing as additional beds come into the country, ventilators along those lines, just in case we do see a fourth wave, seeing that we are entering the winter and the flu, so all of these play factors.
Like every country in the world who is responsible, COVID is very unpredictable. And even though our numbers are going down now, that may not be the case 3 to 4 months from now. We have been watching other countries, and we are confident that our responsibility as a government is to prepare our healthcare infrastructure for the possibility of what is to come. As Minister of Health and Wellness, I'm doing everything in my power to try to prepare our facilities for what is to come. And I'm reaching out to our partners. I'm actually looking in the private sector. We are looking for equipment. We are doing everything in our power to try to ensure to prepare us in the event, God forbid, we find ourselves in the position as some other countries, particularly in Europe.
Nancy, can I actually, as we move into this era of more self-governance, is there specific, and this is technical, specific metrics in which we could see certain measures reintroduced? Is there a certain positivity rate that we would see before certain things kick in? Is there a certain hospitalization levels specifically before we see certain measures introduced? Is it mapped out scientifically like that in terms of specific metrics?
Well, we have metrics, and we have guidelines that has come our way from different countries and through PAHO and WHO, and things that we need to do if we see the numbers going up, things that we can do if we see the numbers going down. And so there is a lot of literature out there, and our technical team, our responsibility is to review it. We are an interesting country. We're an archipelagic nation, and so we have islands all over the place. And one of the greatest challenges we do have is with cases in our family islands and the logistics needed in order to move those individuals who may decompensate to the capital for tertiary health care. And so we're looking at our clinics. We have to look in the short term while we plan for the medium and long term. And I've said it before, and I would say it again, there is resources that are now being put in place for us to be able to upgrade our clinics and to make sure that we have isolation facilities in the family islands so we can do a better job to manage those cases. And so there's many healthcare professionals as well as individuals who are assisting us. And when you look at our steering committee or our consultative committee, you'll see people from all walks of life. We are contemplating adding a legal person on board and some other individuals. And we will make sure that these individuals are in place as needed. And so we are preparing. We are preparing. We have metrics. All of it's not worked out. COVID is brand new. We listen to what the Harvard group may say or other groups, and we try to implement the best tools possible to manage the pandemic in our setting. One of the things I'd like to see is while we're managing it, we can put the proper variables in place so that we can begin now reporting into the international journals of our experience. And maybe other countries can learn from the type of makeup we have as an archipelagic nation.
What I want to know is if you recall, 140 hospitalizations was considered the breaking point around that number. If we hit that number, what happens?
Well, for us, we have resources at our tertiary healthcare facilities. Maybe not adequate. My job is to find additional resources and bed space. I'm looking at that. Unfortunately, brick and mortar, it takes a while, so that's not a short-term thing for me. I have to find access to additional field hospitals or the possibility for us to be able to do something very quickly as other countries in the Caribbean has done. And so I'm looking all over to prepare us in the best way we possibly can in the fight against COVID. But I want to let everyone know that even in the fight against COVID, we lose lives. It happens. And our statistics as it relates to non-communicable diseases and obesity in the Caribbean is very high. We probably rank the highest in the Caribbean. And our outcomes are directly tied in to non-communicable diseases. And so we have to look at that as well. But those things are not the short-term solutions. The short-term solutions, if we have a fourth wave en route, I need to find additional bed space. I need to find medications. I need to make sure that we get better outcomes and try to prevent less people dying as a result of COVID as we possibly can. So I'm doing those parts.
Let's take two more questions.
Oh, I was good. Okay, well, I had 3 more questions, so I guess I'll
Two.
think of.
Best two. Go ahead.
Okay, when can we see the national rollout of the free testing initiative?
Well, first of all, I've said it before. Free testing requires medical algorithms. Medical algorithms are absolutely essential when we begin to put in the rapid antigen tests. Rapid antigen tests is a good screening test, but it's not diagnostic. And we need to be able to ensure that the results of those rapid antigen tests fall in line into our database. Now, as we begin to roll out free testing, there are certain requirements from labs in order for reporting to be done in real time. That information needs to be downloaded into our database or an app, and that needs to go into our digital platform that we are now shortlisting to get to market as soon as possible. Free testing without screening and digital monitoring is like bread without butter. So the two go hand in hand, and we are now in a process where we are reaching out to private sector groups to find individuals who can build this database for us. Our contact tracers are being trained. They're being trained. It's a digital platform, and this digital platform needs to be expanded. We need to expand that so that we can begin to report in real time, and when we do find a case, we need to be able to deal with that case in the first 24 hours. Difficult to do manually. It must be done digitally. And that's the direction we're heading in.
Question?
I have a question. My
Yes.
question is, you address vaccination and encouraging persons to get vaccinated, but we still have a number of persons who have vaccination hesitancy, and it's been said several times that the vaccine is basically almost our way out of this pandemic. What is the ministry and health officials are doing to address this?
We're doing everything in our power. As a matter of fact, I was late because I was with the vaccination committee. Our job is to see something that is down the road and devise strategy in order to prevent us from going into that hole. We have a surplus of vaccines now. The Bahamian people are coming out, but not at the numbers we expect. We are planning to do some new innovative things in communication and encouraging individuals to come out. Educational seminars, taking the vaccine to areas where people can't come to us, and the list goes on and on. It's a very complicated issue, extremely complicated, and how do you advise individuals who are adamantly against taking the vaccine to take it? It requires lots of strategies. One of the things we realize that I should not be the voice, and we can find people from all walks of life who can be able to encourage people in their church groups, in their social gatherings, to be a part of what we're doing to protect us and to ensure that our healthcare services do not collapse as a result of the possibility of unvaccinated people who happen to decompensate going into the emergency room at the same time. We have a small healthcare system, and we need to be mindful. And again, I trust that everyone here in the media is vaccinated. It's the right thing to do, you know, but of course we made it clear it's choice. And we intend to hold that as long as we possibly can. But one of the things that concerns me in the data is that we're seeing healthcare workers who are on the front line still have the issue of not being vaccinated. And we need to do a lot of work to fix that. We have to do a lot of work for it. And we had big discussions today on strategies, on how to do it. We have to be innovative. What happened in the second wave and the third wave, the strategies used then may be obsolete as we move into the fourth wave. So we have to keep our thinking cap on. This thing is changing. And the way we attack it and the way how we deal with it must change to meet our circumstance in the country. But before I go, I want to give some good news, but I don't think I'll do it. I'd like our CMO to actually come up. I know I put you on the spot, but you know, we've been working extremely hard. And she has something really good to say today as a result of all of our hard work. CMO, please give us the good news.
Thank you, Minister. Good afternoon, all. Just as I was on my way to join Minister and colleagues here, I received a notification from the Caribbean Public Health Agency, CARFA. We work closely with them regarding the CDC travel advisory. And as we all know, we would have been at a level 4. The notification actually, it was a congratulatory notification to say that we have been now downgraded to a 3 based on the data recently submitted. So I think the minister wanted me to say that. So here we are. So I would say we have to continue to do what we're doing as a country so that we can continue to, you know, either move down that ladder, but definitely not go back up to a 4. Thank you.
And Dr. McGill, if I may, is that based mainly on the vaccinations or the cases going down, or both?
A combination. They have a combination of indicators that we monitor, and we are, I would say, regularly reporting on those indicators, and based on the last report that was submitted, we were able to actually move down.
When was that report submitted?
Ooh, that would have been a day or 2 ago. Mm-hmm. Thank you.
And of course, as you can imagine, that's excellent news for those who are tuning in, particularly for our number 1 industry, where a level 4, it comes with it a no travel advisory. So now with level 3, it makes it clear that people can travel, particularly corporate world. Conferences can now be held in the Bahamas because we're now at a level 3. So that is significant for the Bahamas and definitely good news for the Bahamas. As we close, just a reminder to everyone that we all have a part to play in ensuring that we continue in this trend. And that is, each of us have to do our part in ensuring that we follow the protocols, even with the state of emergency being lifted. Continue to follow the protocols. Continue to do what is correct. Continue to follow sanitizing, washing your hands, wearing your mask, social distancing. Let's continue to be responsible individually, and we'll continue to reap the benefits collectively as a nation. Colleagues, thank you for being here on a Friday. I know it is like as a Friday for journalists. Thank you so much. Have a good afternoon, everyone.